Alexis McCarty. My case number is 0524, and I will be presenting the street killers getting out of hand. Fentanyl. Fentanyl is a potent synthetic opioid drug that has been approved by the FDA for the use of pain relief and analgesic. It's approximately 100 times more potent than morphine and 50 times more than heroin. As a pain reliever, fentanyl can produce effects such as relaxation, euphoria, pain relief, sedation, and confusion. Where the problem lies. Throughout time, there's been rapid changes in death rates due to the increasing use of fentanyl, along with the fact that fentanyl has been the main contributor to cocaine-related overdose. From 2015 to 2017, the death rates had increased by 55% just in New York. Looking nationwide, synthetic drugs such as fentanyl are now the most common drugs involved in overdoses leading to death. Looking at this graph provided by the CDC Wonder Online Database, in early 2023, there is a rapid spike in 2015, and in national drug-involved overdose. Deaths among all ages and synthetic opioids other than methadone, primarily fentanyl, have reached almost 70,000 deaths as of 2021. This trend demonstrates how synthetic opioid overdoses have become an increasing factor to skyrocketing deaths in recent years. And in late 2019, the trend further proves that these deaths have been continuing. The abuse is limitless. Unfortunately, this problem reaches way past the limits of our nation. The illegal use of fentanyl, most often associated with recent overdoses, is made in labs. This synthetic fentanyl is sold as powder, where it is then dropped onto water paper, put into eyedroppers, nasal sprays, or made into pills that give the appearance of opioid pills. As seen in this image, in May of 2023, the Ohio Bureau of Criminal Investigation was identified and confiscated the rainbow fentanyl, which is designed to resemble candy, and it is used to drive addiction among young people. These particular pills originated in Mexico, but before they could be distributed, they were confiscated, and there's been no further restrictions on the trafficking of these drugs. All around the globe, the severity of fentanyl abuse is branching out to Latin American countries where El Salvador, Uruguay, Brazil, Mexico, and so many other countries deal with millions of drug-related deaths. Unfortunately, little is known about the status of fentanyl use in other countries, and high-quality research is urgently needed to get a better understanding of the real burden of opioid abuse, especially having to do with fentanyl. As you can see in this graph provided by the UNODC in 2020, the shaded regions in deaths is millions, and particularly in regions such as Canada, the US, and Australia, there's been large distributions of fentanyl, but it's also clear to see the branching of drugs throughout South America and in these Latin countries, and even in Europe and Asia. There is a solution. Addressing it is crucial, and looking through different scopes is also crucial when looking at the solution to fentanyl use. Specifically addressing the issue from a technological stance, a common solution could be as simple as computer-based cognitive behavioral therapy, or CBT. CBT is a common type of talk therapy working with a mental health counselor to help you become aware of inaccurate or negative thinking, so you'll be able to view situations clearly and respond effectively. So what has been done? Cognitive behavioral therapy is often used as a way to treat a wide range of issues. It is often the preferred method because of its ability to quickly identify and cope with specific challenges. It has also been proven to take fewer sessions than other types of therapy because of the way that it is structured, along with being known to improve substance use disorders. So in the graph, you can see the addiction cycle, and it is often seen as impossible to escape because of the shame and guilt effort to abstain, internal and external triggers, cravings, anxiety, inability, and then back to the abuse. However, with CBT, you were able to pinpoint these specific cravings and external triggers and find the solution on how to treat it. So the solution practice. We are now allowing individuals to cope with their cravings and improving decision making when it comes to being able to refuse drugs, and therapists are now using computers to help with accomplishing these goals. A system was recently tested by Kathleen Carroll and colleagues at Yale, which uses a 6-game module based on previously proven CBT model. There was a 36% significance period where patients remained abstinent from cocaine use for 2 to 3 weeks when using the computer-based training group, whereas those who went without it was only around 17%. Overall, using technology to improve fentanyl abuse can have long-lasting effects and can save millions of lives.